Heart murmurs are abnormal sounds during the heartbeat cycle, such as whooshing and swishing, made by turbulent blood flow in or near the heart. These sounds can be heard with a stethoscope. I myself have a heart murmur. I first found out about my heart murmur when I was in high school. In high school, I was very athletic. I ran track and I played football. My junior year, my doctor noticed I had a heart murmur and told me I had to take a break from sports until further notice. This news was shocking to me because I was aware of how important the heart is. And after countless checkups, my doctor declared that my heart murmur was innocent or harmless. After doing research, I learned that there are two different types of heart murmurs. There are innocent heart murmurs and abnormal heart murmurs. Abnormal heart murmurs are harmful. I also learned that exercise and pregnancy can result in heart murmurs. There are 7 characteristics of heart murmurs. Their timing, location, radiation, shape, pitch, intensity, and quality. Now that I spoke about the different types of murmurs and characteristics, what is a heart murmur? Well, a heart murmur is an abnormal sound during the heartbeat cycle, which are caused by turbulent blood flow in or near the heart. These sounds can be heard with a stethoscope, or in some cases even without. Heart murmurs can be present at birth or develop later in life. A heart murmur isn't a disease, but murmurs can indicate an underlying heart problem. Most heart murmurs are harmless, innocent, like mine, and don't need treatment. Some heart murmurs may require follow-ups. Some murmurs require treatments which is detected at the cause of the heart murmurs. Causes of heart murmurs. According to WebMD website, there are 2 types of heart murmurs: innocent murmurs and abnormal murmurs. A person with innocent murmur has a normal heart rate. This type of heart murmurs are common in newborns and children. An abnormal heart murmur is more serious. In children, abnormal murmurs are usually caused by heart disease. In adults, abnormal murmurs are often due to acquired heart value problems. An innocent murmur can occur when blood flow more rapidly through the heart. Conditions may cause rapid blood flow through the heart, resulting in innocent heart murmur. Causes of innocent heart murmurs are physical activity or exercise, pregnancy, fever, changes in the heart structure such as changes from heart surgery, or not having enough healthy red blood cells that carry adequate oxygen to your body tissues. Also, an excessive amount of thyroid hormones in your body. Changes to the heart due to aging and heart surgery may also cause innocent heart murmur. Innocent heart murmurs may disappear over time, or some may be there your entire life without ever causing further health problems. The signs of and symptoms may include poor eating and failure to grow normally in infants, shortness of breath, which may occur during physical excretion, excessive sweating, chest pain, dizziness and fainting, a bluish color in the skin, especially on the fingertips and lips, chronic coughing, swelling, or sudden weight gain, enlarged liver, or enlarged neck veins. There are increased risk factors that increase your chance of having underlying condition can cause heart murmur from birth. These include family history of heart defects, illness during pregnancy, taking certain medication or illegal drugs while during pregnancy. Factors that can increase your heart murmur is uncontrolled high blood pressure, a history of fever, past radiation treatment involving the chest, a previous infection or lining of the heart, past heart attacks, high blood pressure in the lungs, and a weakening of heart muscles. As I mentioned earlier, there are 2 types of heart murmurs, innocent and abnormal. There are many causes and 7 characteristics of heart murmurs. I learned that Even if you are healthy, you can still develop a heart murmur. During the research, encouraged me to see my doctor because I read that heart murmurs can cause further health issues. I think everyone should get their heart checked often because murmurs are very serious and could be developed at any age.